I want to begin with a question that I ask myself every time I sit with a patient who has just received difficult news about their kidney function. Not a question about medication, or about treatment options, or about what comes next medically. A quieter question. One that tends to land in the room with a particular weight. How long has this been building? Because in almost every case, almost every single one, the answer is years. Not months, years. And during those years, the person sitting across from me was eating every day meals they had no particular reason to question. Meals that felt familiar, often healthy, sometimes even virtuous. Meals that were, in ways they were never told, accelerating damage to organs that were already quietly struggling. Well, I'm Dr. Naira Stein, Senior Health and Wellness Consultant, and if you are over 60 and you care about your kidney health, and after everything your kidneys have done for you over the course of your life, I believe you do, I want to invite you to stay with me today for one of the most practical conversations we will ever have together. We are going to talk about 5 specific foods that research consistently links to accelerated kidney damage in older adults. Not to frighten you, not to strip the pleasure from your table, but to give you the information that allows you to make choices with full awareness. The kind of awareness that, compounded over weeks and months and years, can genuinely change the trajectory of your kidney health. You deserve that information. And we are here to give it to you with the honesty and the care you have always been owed. Before we get to the 5 foods, I want to make sure we are sharing the same understanding of what we are trying to protect and why it becomes harder to protect it as the years pass. Your kidneys, those 2 fist-sized, bean-shaped organs sitting quietly against your back beneath the lower ribs, are performing a task of extraordinary complexity every single minute of your life. They filter your entire blood volume roughly 30 to 40 times every day. They manage the concentrations of sodium, potassium, phosphate, and calcium in your blood with a precision that keeps your heart beating in its correct rhythm and your muscles contracting as they should. They regulate blood pressure. They produce hormones essential for red blood cell production. They activate vitamin D. They maintain the acid-base balance that your cells depend on to function. And they do all of this without ever asking for acknowledgement, without producing pain when they are under strain, and without sending signals that most people know how to interpret until the situation has already become serious. The kidneys are, in the truest sense of the phrase, silent sufferers. They absorb dietary insults year after year, compensating brilliantly, masking their own distress, until one day the compensation is no longer enough, and the numbers on a blood test begin to shift in ways that cannot be ignored. After 60, this vulnerability deepens in ways that matter specifically to the food conversation we are about to have. Kidney mass decreases with age. The number of functional filtering units, nephrons, declines, and unlike some other cells in the body, nephrons do not regenerate. Blood flow to the kidneys diminishes. The kidney's ability to respond to sudden changes in mineral concentrations, fluid levels, and waste loads becomes less nimble. A dietary burden that a 40-year-old kidney absorbs and corrects without effort can accumulate in a 60 or 70-year-old kidney in ways that register as tissue damage. The same food, in the same portion, eaten by 2 different people a generation apart in age, can have genuinely different consequences for their kidneys. This is the context within which the 5 foods we are about to discuss must be understood. The first food is one that I have come to think of as perhaps the most deceptive item in the modern food supply, specifically because it has been packaged and marketed and positioned in ways that suggest health, convenience, and care. Processed and packaged soups, including canned soups, instant noodle soups, powdered soup. mixes, and the widely available ready-to-heat varieties that line supermarket shelves, are among the single highest sources of dietary sodium available, and they are consumed by enormous numbers of older adults who choose them precisely because they seem like a sensible, warming, manageable meal. Here's the reality behind that appealing packaging. A single serving of a standard canned soup can contain anywhere from 800 to more than 1,400 milligrams of sodium. The daily sodium intake recommended for adults, and particularly for older adults at elevated risk of kidney and cardiovascular disease, is no more than 1,500 to 2,000 milligrams in total, across the entire day. A single bowl of canned soup can therefore deliver close to an entire day's recommended sodium limit in one sitting, before any other food has been consumed. Why does this matter so specifically for the kidneys? Because sodium regulation is one of the kidney's primary responsibilities, and it is a responsibility that becomes more burdensome as filtering capacity declines with age. When large amounts of sodium arrive in the blood, the kidneys must work to excrete the excess through the urine. This process requires increased blood flow through the kidneys and increased pressure within the tiny filtering structures. Over time, chronically elevated sodium intake raises systemic blood pressure, and high blood pressure is the second leading cause of chronic kidney disease globally, directly damaging the delicate capillaries that feed the nephrons and progressively impairing their ability to filter. It is a cycle that feeds itself. High sodium strains the kidneys struggle to manage blood pressure, elevated blood pressure damages the kidneys further, and so it continues, meal after meal, year after year. There is an additional dimension to processed soups that is worth naming. Many contain phosphate additives, compounds used to extend shelf life, enhance texture, and improve flavor stability. Unlike the naturally occurring phosphorus found in whole foods, these synthetic phosphate additives are absorbed by the body at close to 100% efficiency. For aging kidneys already managing phosphate balance with reduced capacity, this highly bioavailable phosphate load contributes to elevated blood phosphate levels that damage blood vessels, accelerate bone mineral loss, and place the kidneys under additional strain. The warm, nourishing bowl of soup is carrying a burden far heavier than it appears. The practical path forward here is not to abandon soup. Soup, made from whole ingredients with controlled sodium, can be one of the most kidney-friendly meals available. It is to read the label before the bowl is filled, and to consider whether what is in that can is truly serving the organs that will spend the night processing it. The second food brings us to something that sits at the center of comfort eating for many older adults, and I want to approach it with the sensitivity it deserves. Processed deli meats and cured meat products. Sliced turkey, ham, salami, smoked chicken, packaged meat slices of every variety are a staple of quick lunches, light dinners, and the kind of easy, no-effort meals that feel manageable when energy is low or cooking feels like too much. And I understand that. I understand the appeal profoundly. But I also understand what these products do inside an aging kidney, and I cannot in good conscience leave it unspoken. Processed meats carry a sodium burden comparable to processed soups, sometimes even greater, because the salt is distributed through every fiber of the meat rather than diluted in liquid. A few thin slices of deli turkey can deliver 400 to 600 milligrams of sodium. A serving of salami or smoked ham can push well past that. But sodium is only the beginning of the concern. Processed and cured meats are also among the richest dietary sources of protein, and specifically of animal protein, which generates a higher acid and waste load during metabolism than plant-based protein sources do. The kidneys must filter the nitrogenous waste products generated when protein is broken down. In a young, fully functioning kidney, this is a manageable task. But in an aging kidney with reduced nephron mass and slower filtration rates, a high protein load, particularly from animal sources consumed regularly and in significant quantities, accelerates a process called hyperfiltration. The remaining nephrons essentially work at maximum capacity to process the increased waste load, and sustained hyperfiltration is one of the documented mechanisms by which kidney function declines over time. Research in adults with early kidney disease consistently shows that reducing animal protein intake slows the rate of kidney function loss more effectively than almost any other single dietary change. And there is a third layer specific to processed meats, the preservatives. Nitrates, nitrites, and various curing compounds used in the production of these meats generate oxidative stress and inflammation in the body at the cellular level. For kidneys already managing low-grade inflammation, which is a near universal feature of aging kidney tissue, this additional inflammatory burden is not trivial. It compounds what is already present and accelerates the degenerative process that dietary choices have the genuine power to slow. The third food is one that I find produces the most visible surprise in my patients when I name it, because it sits firmly in the category of foods people have been told are good for them, full stop, without nuance, without qualification. Bananas. And more broadly, the category of high potassium foods consumed in large amounts and with significant frequency. Potatoes, oranges, tomatoes, avocados, dried fruits, and certain fruit juices alongside them. I want to be careful here because the nuance matters enormously, and I do not want to leave anyone with the impression that these foods are universally harmful or that fruit and vegetables are a problem for older adults. They are not. But for older adults with reduced kidney function, which, as we have discussed, may be more widespread than blood tests currently reveal, the potassium management question is one of the most clinically important dietary considerations that almost no one is having with their patients. Potassium is essential. The heart, the nerves, and the muscles all depend on precisely regulated potassium levels in the blood. And the organ responsible for maintaining that precision is the kidney. Healthy kidneys monitor blood potassium continuously and adjust excretion accordingly, keeping levels within a narrow, safe range regardless of how much potassium is consumed. But aging kidneys with declining function perform this regulation more slowly and less completely. When potassium-rich foods are consumed in large amounts, a large banana, a generous portion of roasted potatoes, a tall glass of orange juice, a bowl of tomato-based stew, the potassium entering the bloodstream can temporarily rise to levels that the kidney cannot quickly normalize. The medical consequence of elevated blood potassium, hyperkalemia, begins with muscle weakness and progresses, in more significant elevations, to dangerous disruptions of the heart's electrical rhythm. This is not a theoretical risk for older adults with reduced kidney function. It is documented, it is underappreciated, and it is preventable with awareness. The practical guidance is not to eliminate these foods, but to be conscious of portion size, frequency, and combination. Eating a banana alongside a large glass of orange juice and a tomato-based dish in the same meal represents a potassium load that an aging kidney must work significantly harder to manage than any one of those foods alone would require. The fourth food is one that has occupied a complicated space in public health messaging for decades, and that complexity has made it genuinely difficult for older adults to know what to believe about it. Red meat, particularly in the forms most commonly consumed in the Western diet, which is to say, large portions of beef, lamb, and pork consumed frequently throughout the week, often as the centerpiece of the main meal. I am not here to tell you that red meat is poison, or that a person who eats a modest serving of well-sourced beef several times a week is doing something categorically harmful. That is not what the evidence shows. but I am here to tell you what regular large portion red meat consumption does specifically to the kidneys of adults over 60, because the mechanism is important and almost never explained. Red meat, when metabolized, generates several compounds that place a direct burden on kidney filtration. Creatine, found abundantly in muscle tissue, is converted in the body to creatinine, the very waste product that kidney function tests measure. Eating a large steak raises blood creatinine meaningfully for several hours after the meal, not because kidney function has declined, but because the metabolic load has temporarily increased. For a person already close to the boundary of reduced kidney function, this regular post-meal creatinine spike contributes to the pattern of hyperfiltration we discussed earlier. Over years of large, frequent red meat meals, the nephrons are repeatedly pushed toward maximum work capacity, and nephrons subjected to chronic hyperfiltration show measurable structural damage over time. Red meat is also rich in purines, compounds that are metabolized into uric acid. The kidneys are responsible for excreting uric acid, and when production consistently exceeds excretory capacity, as it does in older adults with both high purine intake and reduced kidney function, uric acid accumulates in the blood. Elevated uric acid contributes to a specific form of kidney damage called urate nephropathy and dramatically increases the risk of gout, which is itself associated with accelerated kidney disease progression. Reducing the frequency and portion size of red meat consumption is one of the most impactful and evidence-supported dietary steps an older adult can take for long-term kidney protection. The fifth food is the one that I believe surprises people the most consistently, and the one I most want to explain carefully because it is deeply embedded in the eating habits of older adults who are actively trying to be healthy. Whole grain bread, brown rice, whole wheat pasta. In other words, the staple complex carbohydrates that public health guidance has encouraged for decades as the foundation of a heart-healthy, fiber-rich diet. For most adults, these foods are genuinely beneficial. I am not disputing the value of whole grains. But for older adults with reduced kidney function, and particularly for those managing phosphate balance, whole grains present a specific and rarely discussed challenge that deserves honest acknowledgement. Whole grains are significantly higher in phosphorus than their refined counterparts. Bran, the outer layer of the grain that makes whole grain products nutritionally superior in so many ways, is also where the phosphorus is concentrated. And while the phosphorus in whole grains is largely in a form called phytate that the human digestive system absorbs less efficiently than the phosphorus in animal products or additives, regular large portion consumption of multiple whole grain foods throughout the day still contributes a meaningful phosphorus load that aging kidneys must manage with diminishing efficiency. When phosphate levels in the blood rise beyond what the kidney can comfortably excrete, the body responds by releasing parathyroid hormone to compensate, a hormonal cascade that, sustained over time, draws calcium from the bones, contributes to vascular calcification, and places the heart and kidneys under compounding strain. This is not an argument for switching back to white bread or processed grains. It is an argument for portion awareness, for understanding that even foods genuinely rich in health benefits can carry consequences that matter specifically for the aging kidney, and that eating moderate portions of whole grains as part of a varied diet is meaningfully different from centering every meal around large servings of them. I want to close today with something I carry with me from every conversation I have had with a patient in the aftermath of a kidney diagnosis that came too late. The feeling is not anger, and it is not resignation. It is a quiet, persistent wish that someone had told them earlier. Not in vague terms about eating well and staying healthy, in specific terms, with specific foods named, with the reasons explained clearly enough that they could actually make different choices. That is what today was about. You are not powerless in this. Your diet is not a minor footnote to your kidney health. It is one of the primary authors of it, written one meal at a time across the decades. And now that you know what these 5 foods do and why, you have something that no medication can substitute for: the knowledge to make different choices before the damage demands them. Your kidneys have given you everything, quietly and without complaint, for over 60 years. What you choose to put on your plate is one of the most direct and meaningful ways you can give something back to them. Start today. Start with one meal. The conversation has already begun.